I'm a jack of all trades. Masonry.
John Diaz and other members of Our House are busy getting ready for their big open house. Diaz is doing some landscaping, planting little shrubs in front of the blue wooden two-story house on North Alamo Street.
But I'm going to college right now, so I could get my degree in business management.
34-year-old Diaz suffers from schizophrenia, and he's a valuable member of the Our House family.
I like the atmosphere. You know, people are friendly, and then they're my peers as well. Everything about the clubhouse, everything I like.
Our House is a caring, nurturing community where individuals with mental illness can learn how to reconnect with society. Mark Stolce is the executive director of Our House. He says the members reconnect by running the center themselves.
Really, what's more important than the final decision that happens is the process of making the decision. Example I'll use is when we were trying to decide whether to move the coffee pot, and in most workplaces, somebody would just unplug the coffee pot and move it. But we gave everybody a voice, and everybody had an opinion, and we talked about it for 45 minutes. And the process itself is healing.
Stolce says the fact that the members have a voice and that their opinions matter is important. The Bexar County Our House was the first in Texas. It's based on the clubhouse model, which was first launched more than 50 years ago in New York. Today, there are over 300 clubhouses around the world, and since Our House opened in San Antonio 6 years ago, similar centers have opened in Houston, and there are plans to open ones in Dallas and Austin.
So coming to a program like this really helps folks to stay out of the hospital and to stay out of crisis centers.
Tom Furman is a regular at Our House. He's been coming for the last 3 years. He says the center gives him the stability that he needs, and so he can avoid going back to the mental hospital.
A home away from home, where you do your chores, and it's different than any other psychiatric facility because it's not psychiatric. It's you do your chores and you shoot the bull and you get on out and get home. And
so what we're going to do is today we're going to sign up for some chores. Does anyone want to write on the board? Okay.
In the Our House living room, the morning meeting is underway, and the members volunteer for their daily chores.
So why don't we give Cheryl another task this morning, and can you...
Samantha Melvin is a rehabilitation specialist and an Our House staff member. She leads the meeting, but she doesn't take charge. She says that's an important distinction.
We're all friends here. That's the kind of environment we as the staff try to create. A friendship, not that they see us as authority figures or that we're above them, but we try to create friendships.
Lupe Torres is the spokesperson for the Bexar County Center for Health Care Services, the local authority when it comes to mental health issues. She says Our House has proven to be a benefit to the local mental health community.
It provides a service that was tremendously needed, where consumers or clients could come together that are functioning, that wanted to contribute and be part of a program that helped them with their self-esteem. It has contributed to their well-being and their recovery.
Torres said that the Center for Healthcare Services helped provide some of the seed money to start Our House, and that investment has paid off. But Stolce says there is so much more that can be done for Our House and the local mental health community.
A lot of the larger clubhouses have their own housing program where members can live in their own apartments and they're managed by the members. Because of the lack of affordable housing, they're paying $400 or $500 a month, and you don't get much for $400 or $500 a month. It's a lot of times it's in a not safe area and so forth. So,
but for now, Our House is busy giving members a place where they are welcome for the day and the encouragement to help them make it through the day. David Martin Davies, Texas Public Radio News.